Greetings. My name is Leticia Gaines and I'm a social work student at Liberty University. Today, I would like to talk to you about a tragic crisis that affects the most vulnerable population in our society, babies. The crisis is called abusive head trauma. Now, I've invited two experts today to help me out. The first is Ebony Moore, a U.S. Army Child and Youth Services assistant, and she's going to tell you all about abusive head trauma.
Abusive head trauma takes place in young children as a result of violent shaking or a direct blow to the head. This often occurs due to the caregiver's frustration over infant crying. This crisis typically affects children under the age of 6 months, with the highest prevalence occurring in age 1 to 2 months. It is the #1 cause of death for children under the age of 2. Perpetrators are usually the father, stepfather, mother's boyfriend, female, babysitter, or the mother, in that order.
How does abusive head trauma happen? It's oftentimes triggered by inconsolable crying, which can lead to frustration by the caregiver and violent shaking. So I'm going to use an example and do a demonstration. This is Gertrude, we've named her, and this is pretty much the exact likeness of an infant, right? So looking at Gertrude, her head is much bigger in proportion to the rest of her body. And if you notice, she has a very weak neck where she can't hold the weight of her head. This is why that we hold babies, like we cradle them this way. Now, another thing to notice is her brain. An infant's brain has a much higher water content than an adult, which leaves it with less protection. Inconsolable crying, which I said before, can lead to violent shaking. When a baby is shaken violently, it affects these parts of the brain. And as you can see, this part of the brain includes eyesight, language, we have hand-eye-feet coordination, and cognition here. These are the things that are affected when a child is violently shaken. Raymond is going to talk to you a little bit about the prevalence of abusive head trauma.
Some of the risk factors include caregiver frustration, smoking in the home, lack of experience in prenatal care, history of domestic violence, low educational level, young parents with no support, and inconsolable crying. Some common triggers may include feeding problems, colic, and toilet training, while some common signs of abuse head trauma may be lethargy, decreased level of consciousness, respiratory difficulty, vomiting, poor feeding, and seizures.
The community response is essentially educating the public on the risk factors and the negative effects of abusive head trauma. One of the most useful tools is the Period of Purple Crying program. Now, PURPLE is an acronym that helps people remember. So the P stands for peak. The peak of crying usually happens within 1 to 2 months of the newborn. The U stands for unpredictable because the crying can be very unpredictable at times. The R is for resistance. Now, the crying can be resistance to all of the caregiver's techniques to try to soothe that child. The other P is for pain. So the child will make a painful face. And as a caregiver, seeing your child in pain can be very distressing and will cause you to want to soothe them even further. The L is for long bouts of crying. And depending on the infant, it could be 20 minutes or it could be 2 hours. And the E is for evening. So even though it's unpredictable, crying can happen a lot in the evening, and that is most detrimental for caregivers who are already suffering from lack of sleep. Now, while the current community response is great, which is essentially educating the public, we also need to focus on high-risk caregivers. So a healthier community approach would be to have highly trained medical staff that are able to identify high-risk caregivers, such as fathers, stepfathers, those with limited education, and those in a least economic status. It's really important to remember that abusive head trauma as a result of violent shaking is 100% preventable. We all can make a difference to save these children's lives.